So today our topic is pharmacology of loop diuretics. First we learn about introductions of loop diuretics. So loop diuretics are also known as a high selling diuretics. Okay, so these diuretics are loop diuretics. So they are mainly remove the excess of body fluid or excess of water from the body. Okay, so due to that they can decrease the preload afterload. So due to that reason, so they are used in the management of congestive heart failure or in the case of chronic disease or chronic kidney disease. So where, so these loop diuretics or high saline diuretics are usable. So loop diuretics are the diuretics so that can act on the ascending loop of Henle in the kidney or in the nephron. So this is the location of ascending loop of Henle. So as the key point of diuretics, so PCT is involved in the reabsorption of sodium and water, but descending loop of Henle, it is involved in the reabsorption of water, and ascending loop of Henle, it is involved in the reabsorption of sodium, potassium, calcium, and distal collecting tubule, it is involved in the reabsorption of sodium and calcium. And regarding collecting duct, so where the aldosterone activity was dominant, so that aldosterone act on CD or collecting duct, it is involved or it can inhibit the excretions of body water along with electrolytes. Instead of that, it can enhance the reabsorptions of water and electrolyte from urine back to the blood. But here, so these loop diuretics are high selling diuretics. So they are mainly acts on the thick ascending limb or ascending loop of Henle. It is the site for reabsorptions of sodium, potassium as well as the chlorides. It means, so these loop diuretics are high saline diuretics, so they are mainly inhibit the reabsorption or selective reabsorption process in the ascending loop of Henle or thick ascending limb. So due to that, the sodium, potassium, chloride, they do not reabsorb. So they remain in the blood. That is remain in the urine, not a blood. Okay. So they are always due to their reabsorption inhibitions. So they are cannot be back to the blood. Only so their concentration was increases in the urine. So already you know, so where the sodium concentration was increases, so where the water level is also increases. Okay, so due to that in the lumen, so inside the lumens or inside the nephron, so accumulations of water, sodium, potassium, chloride in the urine can be taken place. So that was back collected to the here, that is the collecting duct. Finally, so the diuresis can be occurs or they excreted from the body. So like that, the loop diuretics, so they are inhibit the reabsorptions of sodium, potassium, chloride by acting on the ascending loop of Henle. Due to that property, so they are decrease or to remove the extra fluid of volume from the body. So due to that property, so they are helpful for treatment of congestive heart failure and as well as the chronic kidney disease or damages. In the case of nephrotoxicity, so were also there is no that much of kidney can be do their function. So due to that, once again, due to failure of kidney functions or malfunctions of kidney, so the body volume was increases. So that was responsible for to cause of the heart attack. So on that cases, so the doctors, so they use the loop diuretics or high saline diuretics to enhance the excretions of the excess of body fluid or body volume along with the electrolytes. So the examples for the loop diuretics or high saline diuretics are furosemide, bemetanide, then torsemide, then paratenide, ethacrynic acid, and as well as the indocrinone. So these are the main drugs. So they are fall under the loop diuretics or high saline diuretics. But in the early, the furosemide, is commonly used as a loop diuretics, helpful for treatment of the edema, or helpful for treatment of the congestive heart failure, or helpful for treatment of the hypertension. But nowadays, instead of furosemide, the torsemide is commonly seen in the prescription for the used as a diuretics, because due to only durations of the action. So furosemide, that will be having around 6 hours durations of actions, but torsemide, it will be having the more than 24 hours. It will be act, it can involve in the to cause of the diuresis. So that's why, so they are commonly used for treatment of hypertension or congestive heart failure. Even so, these are used for the treatment of the edema. Edema is nothing but excess of the fluid or water accumulated in the organs or tissues. So that condition was known as the edema. Okay, so that was also treated with the help of the diuretics or loop diuretics. So now we learn about the mechanism of loop diuretics or high selling diuretics. So before we can go for furosemide, you should be learn, or you should be know how the sodium, potassium, chloride, calcium, magnesium, so they are enter into the blood, or back to the blood, from urine to the, that is the, whatever the cells, so they are present in the thick ascending limb, then back to the blood. So that process was known as the tubular reabsorption. So it is the one of the process or mechanism involved in the urine formation. And tubular reabsorption, it is helpful for to restore the water and electrolytes from urine into the blood. So like that. Okay, so here the sodium and potassium and chloride ions, so they are filtered by glomerular filtration because their size is a very less. So due to that, so they are filtered from the glomerular apparatus. So then they are found in the lumen, or they are found in the urine. So that fluid is present in lumens or tubular. From here, so these sodium and potassium chloride, so they are enter in the thick ascending limb cell with the help of the, that is sodium, potassium, chloride co-transporter. So it is the one of the transporter or channels. It can allow the unidirection flow of sodium, flow of potassium, and flow of chloride. So like that, from the urine, sodium, potassium, chloride, so they are enter into the thick ascending limb cells, or those are cells, so they are present in the border of the ascending loop of funnel, where with the help of this pump, that is sodium potassium chloride co-transporter, so they are allowed the entry of sodium potassium chloride from urine or lumen or tubular into the cell. From here, so these sodium and chloride, so they are enter or reabsorb into the blood. So with the help of the sodium ATPase pump, it can allow the entry of sodium from cell to the blood, and same time the potassium from blood, it can enter into the cell. Okay, back. So this is with the help of the sodium potassium ATPase pump. And here the chloride, it can enter from ascending cell, that is the plasma of the ascending cell limb into a blood with the help of the CLCK channel, that is voltage gated chloride channel. So like that, the sodium and chloride, so they are reabsorbed, so they are back into the blood. So then also, so the calcium and magnesium, so these are also reabsorbed from the ascending loop of funnel. So with the help of the certain channel, so those channels are known as the ROMAC, that is renal outer medullary potassium channel. So these are allow the entry of calcium and magnesium from urine to the blood directly. Okay, and as well as it can allow the exit of potassium from cell back to the urine. Okay, so like that, the sodium, then chloride, calcium, magnesium. So they are reabsorbed with the help of the sodium potassium ATPase pump, CLCK pump, and as well as the Romac channels. So here regarding the furosemide is the loop diuretics. So it is mainly inhibit the, that is the sodium potassium chloride co-transporter. So due to inhibitions of this pump, so there is no sodium, no potassium, no chloride, so they are back into the thick ascending limb, then no back into the blood. So like that, so their reabsorption was inhibited from the loop of anal by administrations of the loop diuretics. Our example is a furosemide. So this furosemide, it mainly inhibit this channel, that is sodium potassium then chloride co-transporter. Due to inhibitions of this channel, the sodium and chloride, so they are deposited into a collecting duct instead of they are enter into the blood. So like that also the calcium and magnesium, so they are cannot be reabsorbed. So they still, so they are present in the sodium and magnesium in the urine by inhibitions of the Romac channel also, as well as sodium potassium chloride co-transporter. So like that, so their loss can be taken plus. Due to that, so these furosemide, so they are helpful for treatment of hypertension by blocking the tubular reabsorption at a ascending loop of anal by inhibiting the sodium potassium chloride co-transport. So due to this reason, so these loop diuretics, so they are helpful for treatment of heart failure, then cirrhosis, the nephrotic syndrome, then as well as the hypercalcemia, then as well as they are helpful for treatment of the edematous patients, or they are helpful for treatment of the edema or edema. So this is the mechanism of the all loop diuretics, and here the example you are explained regarding the mechanism of the furosemide. Its main mechanism is it can target that channel, that is a sodium potassium chloride co-transport. So due to that, so there is no reabsorptions can be taken plus. Due to that, they are only found in the urine, then they are excreted through a urine. Finally, due to inhibitions of the tubular reabsorptions by administrations of the loop diuretics. So regarding properties of loop diuretics, we are here explain regarding furosemide, crosamide, and bumetanide. So regarding dose, so intravenous dose of furosemide is 40 mg and trosamide is 20 mg, then bumetanide is required is only 1 mg. If it is administered through IV means, so they are responsible to cause of the loss of the access of the body fluids along with the electrolytes. Then oral intravenous dosing, that is the 1:2. If it is 40 mg for required for intravenous route means for oral it requires the 80 mg to show a diuretic activity. But regarding trosamide, the ratio should be 1:1. It means the same dose, that is 20 mg, act intravenously to show the diuretic activity, as well as orally it can show the diuretic activity. And regarding bumetanide, the oral intravenous dosing is 1:1. That is 1 mg if you are given intravenous, or if you are given orally, then they can show the diuretic activity. Okay, so next regarding the bioavailability, the furosemide bioavailability is 10 to 100%. Then regarding trosamide, it should be 80 to 100%. Then bumetanide, its bioavailability to show the pharmacological activity regarding the 80 to 100%. So due to this reason, so nowadays the trosamide, it can replaces the furosemide. Regarding trosamide bumetanide, so their bioavailability is 80 to 100%. But regarding furosemide, its bioavailability is only 10 to 100%. Okay. So regarding the T half or drug half life, the furosemide will be having the 1.5 to 2 hours, then trosamide 3 to 4 hours, then bumetanide 1 to 1.5 hours. So regarding the durations of effect or durations of action, furosemide, it can shows the diuretic activity up to 6 to 8 hours. Then regarding trosamide, it can show the diuretic activity up to 6 to 16 hours. But bumetanide, it can show the diuretic activity about 4 to 6 hours. Regarding the popular brand name, so furosemide popularly it has the brand name that is the Lasix. Then Trosamide popular brand name is a Demadix. Then Bumetanide brand name is popular brand name is a Bumax. So these are the brand names. So they containing drugs like furosemide, trosamide, bumetanide. They are commonly used as a diuretics or the treatment of the hypertensions, because these drugs they inhibit the sodium potassium chloride co-transporter. Due to that, they are responsible to cause a loss of water along with sodium potassium and chloride also. So they are cause the loss of calcium and magnesium. Okay, so regarding the loop diuretic properties, so example should be remember as a ET is fabulous. Remember of drugs, those are fall under loop diuretics. That is ET is fabulous. That is the ethacrynic acid, trosamide, that is furosemide and azoxamide, then the bumetanide. So regarding side effects, you should be remember the side effect as a hypo. Hypo is the side effect of that is a loop diuretics. Hypo stands for hyponatremia, that is the deficiency of sodium in the blood because it causes the loss of sodium. And about 60 to 80% of sodium, so that can be reabsorbed from the loop of phenol. And here the loop diuretics, so they are inhibit reabsorption. Then loss of sodium can be taken plus. So that was responsible to cause of the low concentrations of sodium in the blood. So that condition was known as the hyponatremia, and hyponatremia is the ADR or side effects of the loop diuretics. So another side effect, that is the hypokalemia. Okay, so next one is the hypomagnesemia, and also so they are causes the ototoxicity, that is a problem in the hearings. Okay, so they are caused by deficiency of potassium, deficiency of sodium, and they are also responsible to cause of the deficiency of magnesium along with problem in the hearing by showing the ototoxicity. Okay, so next regarding the clinical uses of loop diuretics. So uses they are remembered as the, that is the he and he. Okay, that is the he stands for heart failure, then hypertension and edema. So these drugs, so they are properly used the treatment of the heart failure by decreasing the preload and afterload by causing loss of sodium along with the water. Then also they are used in the management of the hypertension. Then also, so they are used in the treatment of the edema. So these are the clinical applications of the loop diuretics. So loop diuretics, so they mainly cause are all diuretics. So they mainly cause the loss of water. So excess use of diuretics, so those are responsible for to cause of the dehydration. So due to dehydration, the muscles are under the panic or fatigue can be occur. So that's why unnecessarily you do not go for the diuretics drugs. Otherwise, that candidate was suffering from the myalgia due to loss of sodium calciums in the skeletal muscle. So due to that, the muscles do not contract properly. Then the person was suffering from the muscular problems. So this is the regarding the pharmacokinetics as well as the mnemonics of the loop diuretics.